Today. Good afternoon. As Crystal said, my name is Brian. I'm a consultant and trainer in the CBTP program here at NEOMED in the Best Center. And today I'm going to talk about nurturing your clinical growth. Now, part of the inspiration for this is when I served as a therapist on a coordinated specialty care team, I thought a lot about how to do my best work. And now that I consult with teams, I'm trying to think about how to help other people do their best work. And so learning is a process, and I want to kind of talk today about different learning strategies that you can use to improve your practice, specifically of cognitive behavioral therapy for psychosis or CBTP informed practices. Review core components of CBTP and explore how you can adhere to them, but also be flexible in your application of them. And then just develop strategies for effectively using supervision and consultation as you grow and learn as a clinician or as a provider. So I want to start with a question. How long does it take for knowledge in the field of psychology to become not current? So how long does it stay current? New knowledge in the field of psychology. Feel free to type your answers in the chat, or if anybody wants to take themselves off the mic and share their impressions, I'm happy to hear what you think. Do you have any takers? I'm not monitoring the chat. Do we have any guesses in the chat?
Can read the chat. We have 5 to 10 years, 10 years, 2 years, 2 to 5, 2 to 3.
Okay. Some pretty good guesses there, so I'll give you a minute or two to continue thinking about your answer. But the theme today is your growth and your development as a professional. And an intrinsic part of being a helping professional is our responsibility to learn a body of knowledge about people, how to understand and work with their thoughts, their emotions, and their behavior. And then we try to use this knowledge in our work to help them in their efforts to change. But learning isn't a static process. And so in thinking about the answer to this question, I want you to think also about where you're at in the process of learning. All right, drum roll, please. Here's the answer. So according to some sources, psychological knowledge stays current for about 6 to 7 years, but for some specialties, that length of time actually decreases to 3 or 4 years. So if you work for 25 years in a helping profession, this means you'd have to refresh your body of knowledge about 3 to 4 times over the course of your entire career. Now, staying current in any field can be challenging, and learning anything involves a commitment of time and energy. But it's important to take that commitment seriously because the quality of your work really depends on it. There's multiple ways that therapists and other mental health practitioners learn. One useful analogy here is to think about one's learning experience as a stool with 3 legs. Each leg represents one source of knowledge that's derived in a specific way. These legs are academic research or theory, a practitioner's experiences working with people, and one's own personal experiences, or what some people call lived experiences. These 3 legs roughly map onto a model of therapist skill development called the DPR model. The DPR model describes 3 systems by which therapists learn their craft: declarative, procedural, and reflective systems. But the important thing for you to know is that there are 3 legs of the stool, and to keep balanced, it helps to pay attention to all 3 aspects of your learning and to ask yourself which are stronger and which aren't so strong for you. Learning is a process that evolves over one's career. And in the early stages of a practitioner's career, there is more emphasis on acquiring knowledge and on learning when and how to apply that knowledge. Gaining knowledge alone isn't sufficient for becoming a better practitioner. What you learn can become inert or inactive if you don't use it out in the real world. Experienced therapists also have knowledge about how to apply what they learn. It's the type of knowledge that people learn from what people commonly call, quote, just doing it. But what distinguishes expert practitioners is the reflective component of learning. Self-reflection involves observing and evaluating yourself. being aware of your strengths, your limitations, your biases. It's all a part of self-reflection. And so it's this reflective component of learning that usually takes on a larger role later on in a person's career. But regardless of what stage of your career you're in right now, all of these components of learning are important to think about as you develop your therapeutic skills. And so it helps to think of learning as a continuous process that integrates all three of these systems at all times. The experiential learning cycle that you see here is one way these components are integrated. It shows how you might move from introducing a concrete task to reflectively observing the results of that task, to conceptualizing what you've learned, to actively experimenting with a strategy based on what you've learned. These are the building blocks of the learning process. And so, for example, if you're working with a person who's exhibiting paranoia about being followed, you might first try to explore evidence for his paranoid beliefs. But then, after reflecting on the encounter, you might realize that you found yourself trying to persuade this person that his paranoid belief was incorrect, rather than allowing good Socratic questions to lead him to a similar conclusion on his own. In response, you might take this reflective observation back to your supervisor and practice different ways to approach paranoid thinking using the principles of guided discovery rather than persuasion. And through this practice, you might come to understand that you need to use more empathic listening, you need to increase your use of summaries, and then you might develop ways to use these insights in your next encounter with this person. So as you develop, you're going to be faced with the task of deciding where to focus your energy. What should you learn? There are a plethora of therapeutic approaches to learn about, and it's impossible to learn everything there is to know. But one way to focus is to direct your attention to approaches that are evidence-based and which have direct applicability to the population you serve. Once a model is identified, then you can learn it inside and out. And for those of us who work with psychosis, cognitive behavioral therapy for psychosis, or CBTP, is a natural fit. It's an approach that's evidence-based, but it does take time to learn and do well in practice. Knowing and adhering to the core components of a psychotherapy model like CBTP is important. Psychotherapy is an inherently human endeavor. There's also an art to how you apply it. I'll use an analogy here. Think about cooking. If you're preparing a certain dish, there's a recipe for making that dish. The recipe outlines the ingredients you need to use, but not all of the ingredients have the same value. Some ingredients are essential to the dish, while others can be used more flexibly. For example, a chocolate chip cookie is not a chocolate chip cookie without chocolate chips, right? Well, in the same way, a model like CBTP has key ingredients, and it also has other ingredients that you can play with. For CBTP therapists, one critical objective is to learn the core components of CBTP and apply them with fidelity, but while allowing for some room for creativity with those components that are not core to the model. And so what are the core components of CBTP? Well, the list on the left are the competencies measured by the Cognitive Therapy Scale, which was developed by Aaron Beck and his associates. It's the most widely used general measure of therapist adherence and competence in CBT. On the right is a list of CBTP-specific competencies. You'll notice that the NACBTP standards on the right require that the therapist be competent in the generic model first, but with the added competencies that are specific to psychosis. So for instance, there's an emphasis on adopting a recovery orientation during engagement, using normalizing strategies to reduce stigma associated with psychosis, understanding cognitive formulations for things like hallucinations, paranoia, delusions, negative symptoms, and thought disorder. So CBTP clinician or a CBTP informed provider needs to be familiar with these competencies and to use the model effectively with their clients. And so many clinicians discover that learning CBT presents some challenges. It's normal to encounter these barriers. We're all imperfect. We all make mistakes and we all have bad days. But more importantly, knowing common barriers that many people go through as they learn CBT can help you become aware of them. I'd encourage you to look at this list and think about the areas where you encounter difficulty and make a plan for addressing it. So I'll give you a point of disclosure for me. So one of the things I struggle with is incorporating homework into my sessions with the people that I work with. And since this is an area where I struggle, I've been trying to make a deliberate effort at focusing on that component as I continue to meet with people who have psychosis. Learning CBTP involves more than learning general CBT principles or the model by itself. So as we mentioned before, there's a variety of models of psychosis symptoms, and they can be theoretically complex. When researchers in academic settings develop these models to explain things, they try to be as comprehensive as possible. Academic settings emphasize rigorous analysis over practical utility or realistic application, at least in the research phases, right? And so this can make learning different models of psychosis feel overwhelming, especially for those of you who work in community-based settings, more acute settings like hospitals. Many trainees in CBTP want to develop simpler formulations with their clients. It not only helps them with their own learning, but it also helps the people that they're working with understand these models. And so this is where flexibility with fidelity can come in handy. We all want to simplify models enough so that they can be understood easily and applied in practice, but we don't want to oversimplify them to the point where we lose any of those core components. That's where the tricky balancing act comes in for every clinician. How do we use research to inform our practice? And so in practical terms, how can we improve our clinical skills? Well, the first thing I would encourage you to do is to become an active participant in the learning process. Therapists and other providers often like to get very specific answers from their supervisors or consultants. But one thing we know is that true growth comes from wrestling with difficult problems and actively generating solutions using your own thinking and reasoning. Supervision and consultation is a great way to clarify your thinking and get support enhancing your skills. But the growth starts with you. To get the most out of supervision and consultation, it can be helpful to think of a specific question or issue to discuss. And this can be challenging for lots of reasons. There can be a real sense of vulnerability when a person seeks out feedback or admits that they don't know what to do next. I know I've felt that before. But it's precisely by embracing this vulnerability that you can uncover your gaps and improve. It can also be very helpful to review the common barriers to learning CBT that we mentioned earlier and to seek out opportunities for active learning through role plays, live observations, and fidelity reviews. I'll just say as an aside here, I was learning another approach to family therapy a few years ago where I had an opportunity to have a consultant observe me practicing that model live. It was one of the most valuable things that I've ever done in my career. And so if you have that opportunity, I'd encourage you to use it. Um, Active learning opportunities like that, they can feel risky and intimidating, right? It can put us outside of our comfort zone, but it can really pay dividends to get objective feedback from a peer or another professional. And so in the CBT program here at NEOMED, we're developing a skill development pathway that helps providers foster their clinical growth by learning and applying skills and adhering to the CBTP framework. And so if you're interested in learning more about our skill development pathway, please feel free to reach out to us. So in the spirit of reflective practice, I'll just close by inviting you to think about these three questions. Which legs of your stool are the strongest? Which need to be reinforced? And then what's your plan for improving your therapeutic skills? Hopefully, by answering these questions, you can create a learning plan that will enhance your growth and your development as a professional. Thank you so much. I appreciate your time. Feel free to ask any questions or give any feedback.